The greatest space that has always existed is the space of improvement. Equity has built a reputation of disrupting and transforming the financial landscape in East and Central Africa, pushing inclusion to a level where 90% of Kenyans have access to financial services. In our journey, we realized 40% of default in our loan facilities occurred when a health incident afflicted a family, and the entire cash flow of the family was redirected. That population is just one incident from insolvency. How do we make health inclusive, to democratize health? How can we come together for the very poor who have no access? That keeps me awake.
Accessibility is a problem in Kenya, so sometimes there are not enough healthcare workers, and most of them are posted to the facilities that are in the urban areas, and there are places where there are no healthcare facilities.
A deep dive revealed to us the public medical system was challenged, and as a result, we were feeling a national void of access to health.
Scholars under the Equity Leaders Program
to global universities from financially challenged backgrounds.
We realized that in our scholarship programs to university, 1,800 had done medicine. In our circular thinking, we thought of giving those doctors an opportunity to provide the solutions to community.
The first 5 branches were opened in 2016 in Nairobi and its environs as part of the pilot program to roll out Equity Afya clinics.
We largely see upper respiratory tract infections. We serve chronic diseases, especially diabetes and hypertension. We also serve a large category of dermatological conditions at the clinic. Then we have dental and optical services.
The first ever wellness checkup was done at Equity Afya. So I decided, since I've had a really good experience with these guys, let me just walk there and get my liver checked, my kidney, my cholesterol, and it was fantastic.
The clinics solve a big problem in diagnostic services, considering that Equity Afya model is a comprehensive model. All the patients who walk to an Equity Afya clinics are able to get the same standardized services.
And we can see from 5 clinics to 130 within 5 years. So we can see how it can be scaled. The question is, as the brand become more visible or more popular, will we be able to cope with the numbers? Will we be able to expand fast enough? And that is where I think partnership with the Proparco AFD to reach out to other European partners so that we could be able to scale the reach of the network, so that we have capacity and we are not overwhelmed, because being overwhelmed means compromise on quality.
Equity Bank is not only a client for Proparco. For sure, we provide Equity Bank with senior credit clients, but we also provide them with guarantee facilities, one of them being EURIS. This guarantee is directly provided by the European Union and then being distributed by Proparco.
Besides senior debt and guarantee facilities, Proparco offers technical assistance to maximize equity's positive impact. Together with the European Union, we provided a grant to support the growth of the Equity Afya Health Network in Kenya and its expansion into Democratic Republic of Congo.
We were trained on the issue of risk and risk mitigation and management. We were also trained on the issue of customer relationships.
So far, 74 doctor entrepreneurs managing 127 clinics have benefited from a training program on health entrepreneurship and financial management. And 56 clinics have started a structured journey to improve the quality of care.
The biggest lesson I've learned in my life is about thinking about others. The more we do to society, the more society supports us. If society loves you, nobody can hurt you.